I want to bring in House Majority Leader Congressman Kevin McCarthy right now. Good to see you, Congressman. Thanks so much for joining us.
Well, thanks for having me, and I hope you're staying warm.
Yes, we're staying warm, but it is snowing pretty aggressively here in New York. So let me get your take on this idea that 24 million Americans lose coverage, recognizing, of course, that that's also by choice, because as part of the plan, you're doing away with those mandates that forced people to take on health insurance or pay a fee. So part of it is by choice, but nonetheless, 24 million Americans not insured by 2026.
Well, you first have to remember, too, this is CBO scoring phase 1 of 3 phases for the overall replacement. Because remember, we don't get to replace exactly as we want to in this first phase because, one, you have to go through reconciliation, and you have the Byrd rule. So the Senate doesn't allow us to put all the mechanism in to actually take care of some of those people who are going to be uninsured. Secondly, they take in no process of what Secretary Price, the powers that he has, more than 1,400 in the ACA, to improve and stabilize the market. But you are correct. We're repealing the individual mandate, so there are people who do not want insurance that are forced to have insurance that will choose not to have it. But think of this. I'm actually very encouraged by the CBO report. One, it lowers the premiums, the biggest concern people have out there. Secondly, that it lowers the deficit. And when you look at the small business confidence just booming, that's because it takes away more than $800 billion of tax burden on them. So I'm encouraged by this because this is only phase 1 of our 3 phases. People are going to have more choice. Price is going to be lower. At the end of the day, more people are going to be encouraged to be able to have health care and the health care that they choose to have.
Rand Paul, obviously, with his own plan, has said over the last week or so that it is an expansion of Medicaid. Is it more important, Congressman, to look at the fact that over the near term, your plan allows more people to join Medicaid, or is it more important to take a look at the fact that there's ultimately going to be a cap on Medicaid, which actually contains it?
Well, Medicaid cannot sustain itself. The expansion of Medicaid right now, if you look in just the 10-year window, will cost us $1 trillion in the 10th year. That's how much we spend on the entire discretionary budget, from the military to the CIA to the Department of Agriculture. So it can't sustain itself.